Hello all, my name is Jeremy Roberts. I'm a PGY6 Pediatric Rehab Fellow at Children's Hospital, Colorado, and I'm one of the Physiatry and Training Council Board members on the Medical Education Committee. Welcome to our Q&A interview with Dr. Stephen Flanagan, the president of AAPM&R, as well as the chair of Rehabilitation Medicine at New York University Grossman School of Medicine, and the medical director of Rusk Rehabilitation at NYU Langone Health. Today, we're going to be discussing the PM&R workforce. Specifically, we'll be discussing physiatry's workforce challenges, how AAPM&R is helping overcome these, and we'll end with a wrap-up of Dr. Flanagan's favorite moment as AAPM&R president. How are you doing, Dr. Flanagan?
Great, Jeremy. Thanks so much for talking to me today. Looking forward to chatting.
Yeah, me as well. All right, we'll start with our first question.
Mm.
So we're continuing these Q&A videos by focusing on the barriers the PM&R needs in order to advance our specialty towards the bold vision. Your recent editorial in the Physiatrist focuses on workforce and how AAPM&R is addressing physiatric workforce challenges and needs. Can you share with us a bit more about PM&R's workforce challenges?
Yeah, that is a great question. And, I think the best way to start this off is to just even give an example. Some time ago, Kathy Bell, who was one of the past presidents of the Academy, and I led a conference in Galveston, Texas, a brain injury conference. What we were discussing is the need for long-term follow-up of folks with traumatic brain injury. And as it turns out, I think most people would agree that physiatrists do that better than anybody else. That's part of our training, even if you have not done a fellowship, for example. But when we were talking about it, there had been surveys done by the Academy. At that time, we had about 10,000 board certified physiatrists, and only about a quarter of them had anything to do with folks with brain injury in their practices. And when you think about the fact that there are upwards to more than 5 million people in this country with a long-term problem related to traumatic brain injury, 2,500 physiatrists treating folks with TBI is just woefully insufficient to meet that need. And because no other specialty has that same training. In order to meet the need, the workforce isn't sufficient. Now let's expand that because, as you know, physiatry is such a broad specialty. I mean, we treat people with spine disorders, musculoskeletal disorders. We treat pediatrics, geriatrics, musculoskeletal, spinal cord injury, oncology, cardiopulmonary, and the list goes on and on and on. And given the fact that there are about 12,000 or so physiatrists in the country, again, it's clear that we are not able, with our current workforce, to provide the care that these people need. And physiatrists are truly essential and indispensable and vital in helping healthcare reach that triple aim, which is the best possible population health, to ensure patients have the best experience and that healthcare is efficient. And for those of you who have heard me talk before, you know that I'm about to say that efficiency is just a government euphemism for doing it for less money. And that's what physiatry does. So in order for us to realize our bold vision, which is to ensure that the world, healthcare professionals, the C-suite, healthcare payers, and what have you, recognize physiatrists as vital, essential, and indispensable, we need to expand our workforce. So that's a vital component of the mission of the Academy to ensure that we can make that happen so we can realize our bold vision.